Hey everyone, thank you so much for joining us on today's important video. I'm Joe DeMattos, the President and CEO of HFAM. We're joined today by a very special guest, Dr. Morgan Katz, who's been working tirelessly across all settings during this COVID-19 pandemic. Let me tell you a little bit about Dr. Katz. Dr. Morgan Katz, MD, MHS, is an assistant professor of infectious disease at Johns Hopkins Hospital. Her research has been devoted to making infection prevention practices feasible and effective in the post-acute and long-term care setting. At the beginning of this pandemic, she was named the long-term care incident commander for the COVID-19 response at the Johns Hopkins healthcare system. And she served on the Maryland State Strike Team to provide testing, cohorting, and infection control guidance to long-term care and post-acute providers throughout Maryland. Today, she's serving nationally. She is a member of the Independent National Nursing Home Commission to guide the Centers for Medicare and Medicaid in their ongoing response to the coronavirus in our setting. Dr. Katz, thank you so much for all that you do, and thank you so much for joining us. How are you today?
Thank you, and thanks for having me. I'm glad to be here.
Go ahead. Yeah, absolutely. So I'm going to ask you, let's get really down to the nitty gritty. What are the 3 to 5 steps a healthcare worker across all settings, but especially in post-acute and long-term care, can take to be safer at work in the age of COVID-19?
So we now have a pretty good understanding of the most important route of transmission of this virus, SARS-CoV-2, and that really is respiratory droplets. So that means, like the flu, it's spread through droplets that come out of your mouth and nose when you cough, sneeze, talk, or even breathe or sing. So there are very few kind of clear ways that we know to help prevent infection at work, and I'm sure you've heard some of these before. So number 1 really is to wear a mask at all times. This is important both during patient care and when you're in any area like staff break rooms or charting rooms, or any area where you can't keep within a 6-foot distance from another person. Masks are going to protect you and others in the room with you. And I also really want to emphasize here that the mask needs to be worn properly. So it needs to cover both your nose and your mouth. And if you have to remove the mask to eat or drink, just make sure that you're 6 feet away from another person. And number 2, like I said, is really to try and practice this physical distancing. I know that this is a challenge when you're actually doing care of residents or in a tight hallway when you're walking by another staff member, and that's why we have sort of the second line of defense, which is the mask. And then number 3 is to wear appropriate personal protective equipment during resident care. And that really means I recommend wearing both a mask and a face shield or eye protection during care of positive cases or residents that are under observation or concern for possible infection. Or you can even consider wearing this eye protection at all times if you're comfortable. And then number 4, really we can't stress enough, is to wash your hands. And to remember here that gloves cannot substitute hand washing. You really need both to prevent self-contamination here. So I think those are pretty much the top 4 I have for you now for work.
Really helpful, Doctor. Thank you. So there definitely seems to be a correlation. We saw this here in Baltimore, and we're seeing it across the country between how hot a community at large is, how prevalent the virus is in the community at large, and then how prevalent it is in healthcare and specifically in post-acute and long-term care settings. So same advice to healthcare workers, specifically though in post-acute long-term care. What are the 3, 4, or 5 things that a healthcare worker can do working in the post-acute long-term care setting in the community or at home to remain protected or safer in this age of COVID-19?
Yeah, thanks. This is a really good comment, and it's so important, especially as we're seeing really how pervasive this virus now is in the community. So we know that wearing personal protective equipment correctly, wearing it correctly, protects us from picking up the virus in the healthcare setting. At the height of the numbers in Maryland at Johns Hopkins, we were still seeing a lower positive rate in the healthcare workers than what we saw in the community. And this was really because we were so careful with our PPE use, or personal protective equipment. So what we're seeing more and more is that it is much easier really to pick this up in the community when we let our guard down. So we are all experiencing now some measure of social distancing fatigue. We want our lives to get back to normal. I get that. But I really can't stress enough the importance of continuing safe practices inside work as well as outside of work. It is our responsibility now to try to reduce the spread of this virus, and bringing the virus into a long-term care setting can be absolutely devastating to the residents living there, as many of you have seen. We know that about 50% of people have no symptoms at all. So this is why we really need to assume we are infected at all times to protect other people. So to get back to your question, my top 3 recommendations for staff really outside of the home are, again, to always wear a mask when out in public, limit close physical interaction with others, and to avoid any crowded indoor spaces, and just continue to keep up these safe practices both inside and outside of work.
Well, Dr. Katz, obviously, in addition to being a physician and a national expert, you do work at Johns Hopkins, my alma mater, and you are, in fact, a professor. And so you have a slide to share with us that tells a story that's very interesting. Hope, can we bring up that slide? And Dr. Katz, will you walk us through the slide, please?
Sure. So I really want to give sort of a visual representation here of how we have seen that PPE does work. So this was a study actually looking in China early on in the course of this pandemic, looking at who was infected in Wuhan. And what you see here is the bars are actually looking at, the darker bars are first-line healthcare workers infected with COVID-19, and the lighter bars are non-first-line healthcare workers with COVID-19. And what you see is that early in this pandemic, so in mid-January, before we really had a sense of how the virus was transmitted and how to use PPE and protect ourselves, many of the first-line healthcare workers and the non-first-line healthcare workers were getting infected. And that is because they really weren't wearing PPE. They weren't wearing the eye protection as well as the masks. And then later on in the pandemic, once they sort of activated these emergency responses, they had a sense of this transmission and really enforced personal protective equipment in the healthcare setting. You see that there's a huge reduction in infections in the healthcare workers, and then you see an increase in infection in the community. And what this is saying here is that really as soon as PPE sort of comes into play and we have you're not seeing that the healthcare workers are getting infected, and they're much more likely to get infected from the community when they're not wearing appropriate PPE. So this is why it's so important for us all to know how to protect ourselves and understand that now that we have an understanding of how PPE works and really get a sense of how to use it correctly, we can all protect ourselves in the healthcare setting.
Fantastic. Hope, you can take down that slide now. You know, we're going to be fighting actively COVID-19 until there is a broadly available, effective vaccine. So for the foreseeable future. And because people that are receiving care in post-acute and long-term care are older and have pre-existing conditions, as you said, they're much more susceptible to the virus, and the virus is more fatal with those types of individuals, whether they're in our setting or not. So moving forward, just explain again, because it's just so important, what are the different types of PPE and why are they important?
So I guess first, as we sort of have discussed in depth, is the mask. So the mask is really going to have the biggest effect on how much virus you may spread or inhale. So that's why it's so important to cover both the nose and the mouth at all times. And then next you have eye protection. So this can be both in the form of either a face shield, which will cover the outside of the mask as well as the eyes, which I prefer it, or eye goggles, whichever makes you more comfortable. And the reason for the eye protection is that the virus can be contracted through droplets entering your mucous membranes, like your eyes. So that's why we do require eye shields when caring for any known positive residents or suspected cases. And then you have gowns and gloves, and these are really there to protect the wearer, and really remember that gloves cannot be used in place of good hand hygiene. So that really needs to be paired with any personal protective equipment.
So into the community, it's so very important to remember that when you're wearing a mask effectively at work, it's also very important to wear your mask when you're away from work, to not sort of lower your guard when you're out picking up the cleaning or grabbing dinner or picking the kids up from daycare, to have that mask covering both your mouth and your nose, yes?
Absolutely.
Yeah. At work, tell us a little bit about how important it is to properly don and doff PPE.
Yeah, so as I said earlier, we do have a good understanding and evidence to show that personal protective equipment works to protect the worker when performing care of their patients. But where there can be problems is when a healthcare worker really is not vigilant about how they put on and remove their PPE. So for example, if a healthcare worker doesn't wash their hands before they remove their mask or touch their face, they can potentially contaminate themselves at that point. There's actually a lot of good videos that I encourage healthcare workers to watch that give really a good visual representation of the safe steps when donning and doffing PPE to avoid contaminating yourself. And those are really helpful just to know the steps to take to limit potential contamination. It also can be really helpful to form a buddy system. So ask a fellow staff member, and a lot of facilities have actually done this with their infection preventionists, will watch staff members put on and take off PPE several times to make sure that they have the order in place and they're not making mistakes that could lead to self-contamination. I also really like, just sort of the pictures on the wall of really giving a visual representation of how to do that in the correct order.
Doctor, at work and in the community, a couple of questions. How important is social distancing? And if I'm going and picking up, again, dinner or laundry, is it effective for me to keep, hand wipe or something in the car? And how important is social distancing? And if I go out and run an errand, I'm not at a sink, is it helpful until I get home to sort of use some sort of product on my hands?
Yeah, absolutely. And that's exactly what I do as well. I have my mask in my car. I will always put the mask on before going in any public place. When, it's very easy to just be aware of how close you are standing to other people. Make sure that you're standing 6 feet from another person. And then every time I get in the car, I immediately put on hand sanitizer. And then when we walk in the house, I wash my hands with soap and water.
Well, doctor, this has been incredibly reassuring, and your knowledge and rubber hits the road advice is powerful to folks in our sector. Are there any last words that you'd like to share as we continue fighting this battle together moving forward?
Yeah, I just really want to say thank you to all of you for what you're doing. I know this is an incredibly challenging job, and you are showing up every single day to care for these residents. We know that personal protective equipment is incredibly effective in the healthcare setting and does allow us to do this important work, but we all have to continue to be vigilant and take steps to protect each other in all of our practices, both at work and at home. We will get through this. I know it's been hard, and I truly appreciate all that you have been doing as well.
Dr. Katz, amen. We will get through this together. We'll see you around the bend. Thank you, everyone, for joining us for this HFAM video. I am Joe DeMattos, the President and CEO of HFAM, and today we've been absolutely blessed to be joined by Dr. Morgan Katz, MD, MHS from Johns Hopkins Hospital. Thank you, Dr. Katz.
Thank you.